Hello there. You are viewing the accommodating brain injury tip sheet. So the idea is that you have your tip sheet out and you're making some notes and following along with me. All right. So we first want to all be on the same page as to what is a brain injury. So I don't love the definition on our tip sheet. It's a mouthful. But basically the definition for North Dakota is any damage to the brain occurring after birth and prior to degenerative dementias. So that is the term for acquired brain injury. So any damage. Well, there's two types of damage that can occur though. There is traumatic brain injury or TBI, and those are injuries that happen from external forces. So something outside of the body coming into contact with the body. So motor vehicle accidents, sports injuries, domestic violence, all that kind of stuff makes up TBI. Then there's another side of the spectrum, and that is things like oxygen deprivation. So these are internal things, more things that happen on the inside. So this is strangulation, near drownings, infectious diseases, long COVID, chemical or substance exposure. So if you have needed to be Narcaned, that is oxygen deprivation as well. And again, that chemical or substance exposure. Actually, the most harmful drug for the brain is alcohol. So we need to be really careful about alcohol. And then strokes and tumors as well make up acquired brain injuries. So that is the definition of brain injury. So after birth, prior to degenerative dementia. So common challenges are listed, and there's a whole big long list on that tip sheet, right? And there's a ton of them. So I'm just going to go over the basic definitions of all of these things, but there is a tip sheet and a recording for all of them. So being that the brain controls everything we do, the brain has a lot of things that happen to it when it is impacted, when it is hurt. There's a lot of consequences that could result of that injury. So mental inflexibility is one of them, and that is the inability to respond to changes, such as thinking about multiple ideas at once or switching between thoughts. Okay, so that flexible thinking is hard for someone after brain injury. They get kind of rigid and they kind of want to keep things the same way. And part of that, I think, is because we do teach to do routine. And so we also need to teach that what to do when that routine is not followed. Emotions, common challenges are emotions. It means our mood and emotional reactions are unstable and difficult to manage. So like emotional dysregulation. Again, we have a whole tip sheet and a whole recording on that, so I'm not going to go too deep into these ones. Another common challenge is language problems, and those can result in difficulty expressing or understanding language, both verbal and written. They may cause difficulty with social communication. One of my number one referrals is to see a speech language pathologist after brain injury. These guys are like the gurus on all this stuff, and they're really, really great at all of this. So highly recommend looking into that if this is an area that you or someone you love struggles with. Attention is another common challenge after brain injury. There are several kinds of attention, so I'm not going to get into all those today because I go into all of those in our attention tip sheet recording. And sorry, I'm not trying to send you on a wild goose hunt, but it just doesn't, to me, make sense to really dive deep into all of these right now. So see the tip sheet and recording for more information on attention. Memory is the brain's ability to retain previously experienced sensations, information, and ideas. So a memory impairment makes it difficult to recall, organize, or process information. The big key with brain injury is that individuals usually struggle more with their short-term memory than with their long-term. So a lot of brain injury survivors can chit-chat your ear off about things that happened many, many years ago. But when you ask them about things, this week and yesterday, that might not be the case. Sleep. Basically, after sleep, brain injury is tough. So 40 to 65% of people with mild TBI complain of insomnia. Lack of sleep has a negative effect on cognition, mood, energy levels, and appetite. So we need to make sure we're getting good quality sleep after brain injury. Many people develop sleep apnea after brain injury. So If you find that you're not waking up well rested, you might want to check in with your doctor or with your primary care provider about that and see what we can try to figure out for sleep. There's also all kinds of sleep hygiene things that you can do. But again, check out our tip sheet and our recording for that. Sleep and fatigue are often kind of used co-occurringly, but there is a difference. Fatigue is basically constantly feeling mentally tired. So it can occur after physical activity, but it's more common after mental activity. And after brain injury, fatigue is very common. Yeah, we'll talk more about that when we talk about breaks. Another common challenge after brain injury is organization, and that is the ability to use our time, energy, or resources in a helpful way to finish goals or tasks. And yeah, see our tip sheet for more information. Another one is another common challenge is self-awareness. So that's basically our ability to assess our own abilities and limitations. Individuals with brain injury may not recognize changes in behavior or personality. So they might need us to say like, hey, you're acting really kind of different now. And brain injury is kind of one of those unique disability areas in that it has a pretty distinct, for most people, a before and an after, where they knew themselves prior to injury and they had good skills in place. And then all of a sudden all of that changed. And that can be a really hard thing to accept and to become aware of even, and I think of like driving, for example. Many people learn how to drive at a young age. They drive for many, many years. And if they have a brain injury, sometimes their driver's license gets taken away. And so that's a huge loss of independence. And that's a huge thing to come to terms with, and just being able to assess their own abilities. So having conversations like, okay, we can't drive now because your reaction time is slower, or giving them reasons as to why things are different now. But again, see our tip sheet and recording for more info on that. Another common challenge is delayed processing. That is the brain's decreased or slowed ability to process information you hear, see, or think about. So delayed processing is very common after brain injury. We just really need to slow down and do things nice and slow for them, give them time to think about answers that we might be asking. I think a lot of times this is what gets our clients in trouble socially, and what gets them in trouble even when it comes to like law enforcement. There's so many times in our society when we ask people to think, and do things quick, and individuals with brain injury just need you to slow down significantly. Impulsivity is another common challenge, and that is the conscious or unconscious inability to suppress or refrain from engaging in an action or thought. So this also gets us in trouble when it comes to lots of different things. Spending, we can be an impulsive shopper, right? If we're buying things that we can't afford, this can be impulsive. With the choices we make, we might not think before we speak or think before we act. So we work on a lot of stop, think, act things with our survivors, but please see our tip sheet and recording for more information on that. Another common challenge is physical and sensory motors problems, which can include pain as well as changes in hearing and vision. I would say my second referral is usually vision, or my top two referrals I would say are speech and vision, because the brain is what works the eyes, right? So if our brain is damaged, sometimes our eyes can be damaged, and that can create kind of a really tough thing for people that are trying to see and trying to do things like driving and return to normal life. If their vision isn't at baseline, that can be really challenging for them. Okay, so on the back of your accommodating brain injury, you have this acronym called ROBOTS. So this is a mouthful, but it is a great way to accommodate for brain injury. So an accommodation is basically changing the environment just a little bit for the individual, not even the environment, but just the way you're presenting information. You're tweaking it a little bit to help them understand and comprehend things better. So I'm going to go over each one. So the R is for reduce the amount of information. So I think of this when, we're in the doctor's office. They might have a lot of words that individual might not understand. They might talk about, kind of have those side conversations. We just really want to focus on what is the main goal of this appointment and reduce it down to as little information as possible. You can apply that to any type of area. It doesn't necessarily have to be a doctor's appointment, but we just want to really reduce the amount of information. I think of this in the classroom setting too, like my survivor with brain injury does not need to know all the little details of the lesson, but they need to know the main ideas. Okay. O is for one instruction at a time. So especially when we have multi-step directions and multi-step instruction, we want to try to give it just one at a time, because oftentimes once they finish that instruction, if you gave them another one at the same time, they're not going to remember that second step. So just giving one instruction at a time can really help both parties. So you not getting so frustrated as the one giving the instruction, and the survivor not getting frustrated either with being lost as far as where they are in the steps that you ask them to complete. W, written and verbal whenever possible. 85% of what we learn is through our eyes, is through our vision. So we need pictures, we need visuals, and those can look very, very different from person to person. Like my ones in the middle is a little more for someone that doesn't need as much step by step, but then you look at the one on the far left, and that has each single step written out. And then the one on the right, maybe for someone that's a lot higher functioning, that has the steps down, but they might forget some of the main directions. So anytime we can provide a visual and then also give our words with it, that goes a long, long way. B, breaks are helpful. So someone with a brain injury needs to recharge more frequently than someone without. They need a reset. Depends on the person very much. So, I say 2 to 4 times a day, 5 to 15 to 20 minutes, set a timer. You can listen to soft music or meditation, but I want your eyes. I don't really want their eyes on screens or anything like that. So you can see she's listening to her headphones, but she doesn't have her phone. Her phone is by her side, but it's not right in front of her face. So we need that break. If you're worried you're going to fall asleep, set a timer. Often is better. Routines help. When we can do kind of the same thing every day around the same time every day, then our brain knows what's next, and there's a lot less anxiety and a lot less frustration around the unknowns. So if we can, go for a walk around the same time every day, if we can have our breakfast, our coffee around the same time every day, if we can do meditation around the same time every day, but routine. And I know that we talked about in the beginning how mental inflexibility is also a struggle. Well, we need to teach routine, and I think we build that up first, and then we introduce the idea of, if that routine changes, how do we handle that? What are our coping strategies that we're going to use for changes in the routine? It might be deep breathing. It might be telling that person a few minutes before. It might be telling them days before. It all, like we've said many, many times, brain injury is so unique, and it really depends on the survivor and their impacts and where they're at. But anytime you can have routine, especially when it comes to sleeping and waking too. So we should be going to bed around the same time every night and getting up around the same time every night, even on the weekends. It pains me to say that, because I'm a sleeper inner too. I love to sleep in, but it's really not good for any of us. We should really be following a consistent routine day to day. The A, ask the person to paraphrase or repeat. This is a huge way of gauging comprehension, of gauging understanding of what you just said. So when you have a conversation or you go to a doctor's office, you can say back, okay, so what did they just talk about? What did we just learn? What's different? Or, what did you hear in this appointment? Or what did you hear me say to you? I asked you to do your laundry and the dishes, and maybe you say, what's the first step in laundry? So you can kind of gauge if they understand how to do it. Or what's the first step in doing dishes? Or tell me about how you're going to do that. How you're going to remember to change the laundry from the washer to the dryer. That's a tricky one, right? So setting timer, setting alarms so we don't forget. Our clothes don't turn into a moldy, stinky mess. Okay. Someone could teach my other half how to do that. That would be fantastic. The T is for take time, go slowly. So I have a snail here. So snail time, we just want to be really slow Individuals with brain injury need that time to think. It's not that they can't think or that they don't know the answer. It's just they need time to gather their response and for the response to come out. All of us without brain injury are usually able to do that pretty quickly, and our things happen inside our head so fast that we don't even always know they're happening. But that individual with a brain injury, everything's kind of glitchy now. They need more time. I usually personally count inside my head after I ask a client a question. I will kind of count inside my head, and so that they can have some time to think. And usually I get to about 20 or 30, and then they form a response. So just take your time. There's no rush. The S is simple and organized information is best. And so this is a great way to organize things, is to do them in rainbow color. I don't know, shout out to the Home Edit. I love that. That Getting Organized with the Home Edit is a Netflix show. They have Instagram, they have all these things, but staying organized with your environment can help. But then also when we're presenting information to the individual, we want it to be simple and organized. And we want to try to just use language, very common language. We don't need to use big words. The example I always give is sibling. Sibling means brother or sister. So we don't need to say sibling. We can just say, do you have any brothers or sisters? Just bring it down, right? We don't need to talk over anyone. We don't need to completely like dumb it down, so to speak, either. But I did have a client once that actually used those exact words. You got to dumb stuff down for me, she said. So, you can find your happy medium there, but yeah, there's no need to get out those fancy words. So yeah, that is it for your accommodating brain injury. I hope it goes well. I hope that you find these simple tips helpful. You can contact us at the 855-866-1884 or check out our website, ndbin.org. Thank you.